Hi, Dr. Saxena here, and been talking about intestinal health and all. I certainly believe you have got gastrointestinal tract is the biggest kind of thing. We talk about as a radiologist, I have done a lot of ultrasounds, and the moment we used to see there is a thing called fatty liver in the ultrasound, and we used to tell that yes, your liver is not optimally working, and in fact, I used to tell that okay, fatty liver is quite normal in these days, and you don't have to worry about fatty liver. It's seen in diabetics, and we are talking about non-alcoholic fatty liver disease. This is called NAFLD. But I can always tell you with the kind of things which I tried working with integrative medicine, I became wise, and now I believe that if that is the kind of case where you have got some fatty liver and there is a liver is not properly working, you need to work at that level first, because liver is the primary detoxification organ of the body. It cleanses the body and helps to filter out toxins that are absorbed from the gastrointestinal tract, and it is also responsible for processing and neutralizing external toxins. Liver has an important role to play here. It works 24/7, and I think it's most of the overworked organs. If I want to tell that the number one overworked organ which is doing overtime is liver. It is responsible for processing and neutralizing external toxins such as heavy metals. Most of the toxins will later be excreted through urine and feces. However, there are times when the liver is required to process more toxins than it can handle at one place at one time. This may occur, for example, when the child is treated for an intestinal candidal infection, as the yeasts are being killed off by antifungal agents. They release toxins that can enter the bloodstream and causes systemic problems such as headaches, fatigue, and behavioral aggravations. This phenomena of fungal problems is because of this thing called die-off. We call it as a yeast die-off reactions, and the experience having worked with some things like autism and all that, and when we put that particular antifungal this particular thing yeast treatment, and suddenly the die-off phenomena flares up, and the parents, they get too scared when they see that reaction. What happens is that one approach to addressing this detoxification capabilities are to ensure that the liver detoxification is capabilities are functioning optimally, and once this occurs optimally, everything is good. And this is why many physicians who do heavy metal chelation recommend that their parents see, we have been talking about chelation, we have been talking about something like detoxification and all that. For that, I need to properly prepare the patient, try to give some hepatoproductive things, try to give some liver supports, supplements and all that before taking up the process of detoxification. And yes, detoxification, when you talk about this thing in autism and other things, are not easy, and I want autism parents to understand what is this thing called detoxification. It can be as simple as trying to take out some things out of your skin, or trying to see that your various forms of detoxification. It's not necessarily to be, you can always go for a oral detox also. You need not be IVs and all that. So one thing, this is one of the concerns which most of the parents have got, and most of the patients also, when they think of detox, they think that there's something which is injected, and you are being something like dialysis we are doing. No, it's not like that. It's a process where which we are trying to optimize your detoxing skills, and we try to, at the same time, we are trying to remove that offending thing which is having a problem. So apart from detoxification, the liver has several other vital functions. It helps metabolism of number of hormones, including thyroid hormone, estrogen, progesterone, and testosterone. So what happens is that we are talking about so many things. Testosterone get converts into a 2-DHT, or estrogen gets converted into some things and all that. So the, once if your liver is not optimal, it's not working properly, you are going to get into some of the problems where this kind of this metabolism of hormones doesn't work into proper thing, and you get end result is you get into problem. Apart from that, liver breaks down cholesterol and helps in the regulation of blood sugar levels, and it's also responsible for the production of bile. Bile has very important functions. You have in digestive process, after being manufactured by the liver, it is being either utilized by the small intestine or stored in gallbladder for the later use. So in the intestinal tract, bile is essential for the emulsification of the fat, oils, fat soluble vitamins, and cholesterol. With the help of pancreatic lipase, that is enzyme, it ensures that the fats are properly broken down so that they may be fully absorbed and utilized by the body. So this on this basis, bile also plays a similar role in the protease enzymes and keeping free of harmful microbes. These are the things which are I'm talking about bile, and I'm talking about liver as a whole. This is one thing which we thought we are not. I was just thinking liver is the primary organ of detoxification, and I was not very clear about things. In the sense, I was not aware about what is the role of these intestinal pathogens with the liver, what is this die-off reactions, how things are. So, optimizing this liver is of utmost of liver function. Trying to give it support to the liver is of utmost importance when we are dealing with tricky and uh, chronic diseases. Trying to work with this particular diseases like autism, cancer, trying to work with something like all autoimmune diseases, you need to always optimize the liver. Once we optimize the liver, things can work it out in a proper way. Thank you.